the mining companies who are mining emeralds in Rufanyama to auction the minerals within Rufanyama, because the people of Rufanyama have not benefited much, because all the minerals which are mined are taken out of Rufanyama. So if the minerals are auctioned within Rufanyama, the people benefit. Thank you, Madam Speaker.
The Honorable Minister of Mines and Minerals Development.
Thank you very much, Madam Speaker. Like alluded to in my statement, all the minerals that Zambia has, including gemstones, the policy of this government is that every Zambian must benefit, and we are looking at all various avenues in which we can make sure that Zambians are not hard done by the so-called investors. We are moving in, like I said, Madam Speaker, to make sure that the benefit that must accrue to Zambians. Thank you very much, Madam Speaker.
Thank you. The Honorable Member for Solwezi East.
Thank you very much, Madam Speaker, and thank you very much, Honorable Minister of Mines. My question is quite closer to what has just been said. There's a place called Musakashi in Mshindamo district, closer to Rufanyama. The owner of the Grizzly mines there has never ever taken any social responsibility, but for years he has been siphoning the best emeralds in the area. What assurance are you giving the people of Mshindamo, or Solwezi East, and in particular Musakashi, for the benefits that they need to accrue from that mines, because they have been neglected by Gunasi, the owner of Grizzly Mines, for a long, long time? I submit.
The Honorable Minister of Mines and Minerals Development.
Thank you, Madam Speaker. Madam Speaker, previously we have had situations, Madam Speaker, where mines have declared that they are doing CSR, or corporate social responsibility, when in actual fact not. So we are moving in as the Ministry of Mines to make sure that what they declare on the books is actually what is happening, because most of them have been lying to us that they are doing corporate social responsibility and reporting huge figures. But we are moving in as the Ministry of Mines. That's why we want to establish presence in almost every district where mining activities are taking place, so that we can have a holistic approach to the way that we benefit from these mining companies operating in specific areas. I thank you, Madam Speaker.
Thank you. The Honorable Member for Pambashe.
Thank you, Madam Speaker. Minister, thank you for the statement. Now, Madam Speaker, I am worried by the sweeping responses by the Minister of Mines that are touching clearly on the financial implication. And those statements can only come after confirmation with the Minister of Finance. I want him to confirm, bearing the levels of inconsistency, that what he has promised the Zambian people today are coming to pass despite the financial implication on the treasury, that he's spoken to the Minister of Finance that is going to open offices across the country where mining activities are happening. Some contracts that have been signed with the financial implications on the state are going to be reviewed and renegotiated. I want him to confirm to the Zambian people out there that whatever statement is given today is consistent with the position of the Minister of Finance. I thank you, Madam Speaker.
The Honorable Minister of Mines and Minerals Development.
Thank you very much, Madam Speaker. The Honorable Member must underline the word consult, because I said we are still consulting and see how we can renegotiate. So we are alive to the fact that there could be certain financial implications if there are breaches. So we don't want to do anything that will result in breach and be a financial burden on the Treasury. So what we are doing now, as I said, is that we are consulting to see that we make sure that we can have a presence. And in the consultations, if we are actually told that we can go ahead with that, then we are going to do something that is good if it is accepted. A scenario where we are losing a lot of revenue because we are not capturing all the activities that are going around the country in terms of mining. And that's why we are suggesting they are not actually sweeping statements, Madam Speaker, but they are declarations of intent. Thank you, Madam Speaker.
Thank you. The Honorable Member for Lunte.
Thank you very much, Madam Speaker. Honorable Minister, I would like to appreciate you for coming to account when in fact there is an option of just sitting. In your statement, Honorable Minister, you indicate that government, and I assume it's UPND government, is promoting skills development. I am aware that none of the ministers in the UPND government has promulgated a single policy. But here you are saying government is promoting skills development. Are you confirming that the Honorable Minister of Mines are going to be adopted as you have adopted the promotion of skills development? Thank you, Madam Speaker.
The Honorable Minister of Mines and Minerals Development.
Madam Speaker, I never mentioned that inheriting policies from the previous minister. That's not what I said. Thank you, Madam Speaker.
Thank you. The Honorable Member for Ron.
Thank you, Madam Speaker, and thank you, Honorable Minister, for that statement. In your statement, Honorable Minister, you mentioned that the mining sector contributes about 8% towards formal employment in this country. Honorable Minister, what is your ministry doing to ensure that jobs that can be done by the Zambians, such as driving machines like telex, water bowsers, are not imported by some of these mining investors like it is in my constituency with the 15 MCC, who is also resorted to the cheap way of mining, and that is open pit mining instead of underground mining, which contributes a lot of job spaces. What is your ministry, Honorable Minister, doing to ensure that more jobs, as the new government, promised, is created in the mining sector? I thank you.
The Honorable Minister of Mines and Minerals Development.
Thank you very much, Madam Speaker, and thank you for that question. Job creation is one of the promises that the New Dawn government gave to the people of Zambia as a promise. Madam Speaker, I realize that most mining companies were left to do things on their own without considering the plight of Zambians. That's why we have had so many strikes, because people are paid in peanuts, people are underemployed, jobs that can be done by Zambians are given to foreigners. As the New Dawn government, like I said, sanity returns to the mines forthwith. And we are moving in, like I said, we are doing a countrywide tour of all the mines, and we want to make it clear that Zambians must do the jobs that Zambians should do. We should only have people doing jobs that people coming outside the country should do jobs that Zambians cannot do. So we are alive to that fact. It has been a serious problem. I think that Zambia must now take possession of its expertise and use the expertise that Zambia has. Madam Speaker, we are being done by through the negotiating table with most of these investors. But going forward as the New Dawn government, we will make sure jobs that must be done by Zambians are done by Zambians. Thank you, Madam Speaker.
Thank you. I'm assigning.
Madam Speaker, during the PF government, Konkola copper mines and the Mopani copper mines, just to mention but a few, complained of the high energy costs, which according to them was undermining investments in the mining industry. Now, the president of this country delivered a speech in this August House where he indicated that his government is going to migrate to cost-effective electricity tariffs. Now, I want to find out from the Minister of Mines whether the mines are going to have a special electricity tariffs in order to sustain investments in the mining industry. Thank you.
The Honorable Minister of Mines and Minerals Development.
Madam Speaker, thank you very much for that question. It will be incumbent upon the respective mining companies, production in the mining sector. Of course, as the Minister of Mines, we'll keep an eye and see how we can help in negotiating such good deals that will promote production in the mining industry. I thank you, Madam Speaker.
Thank you. The Honorable Member for Wacha.
Thank you very much, Madam Speaker. Minister, you indicated during the presentation of the ministerial statement that various key stakeholders are being engaged on the various mining activities going on in the country. Would you mind sharing so far the key stakeholders that your minister has reached out to, and if possible, the key outcomes which have come out so far? Thank you so much, Madam Speaker.
The Honorable Minister of Mines and Minerals Development.
Madam Speaker, thank you very much for that question. One of the examples I can give, the stakeholders that we are consulting, Madam Speaker, and also trying to rebrand, is the famous Jeroboams, because we understand that that sector itself, if harnessed properly, it can actually make a lot of Zambians benefit and move from the poverty that I'm lying. So we want to rebrand them. We want to stop calling Zambians as criminals. We want to re-engage them. They are serious stakeholders. So we want to re-engage them because the expertise that they have with rebranding and making them participate normally as part of the key stakeholders, I think that is going to help in developing the small-scale mining industry. I also want to mention that we are safety officers who are going to train the small-scale miners so that they are skilled in terms of observing safety standards as they are working in the mining industries to avoid any disasters. These are just among the many other stakeholders that we are engaging to make sure that mining benefits us as it should. I thank you, Madam Speaker.
Thank you. The Honorable Member for Shiwangandu.
Thank you so much, Madam Speaker. And let me start by appreciating the Honorable Minister for this very important statement. And I'll pick it up from where his last response. Indeed, those small-scale miners who were called names, just as productive as any Zambian can be, and it took a lot of work to bring them, to whip them back into line for them to become law-abiding citizens. Honorable Minister, there is a famous dump site in Usakile constituency, famously known as Black Mountain. It was jointly owned by a private investor and the Zambian government on one hand. And there were negotiations which included an exit option for government through the MIH to get. Now that you are working with the small-scale, small and medium enterprises, what are you going to do to ensure that those negotiations that were done with the investor on one hand and government...
Point of order, Madam Speaker.
...to ensure that...
Point 2, and I read, a member shall refer to another member as he or she or her, and you, not you, which in reference to the presiding officer. Is the honorable member, having been in Parliament for more than 10 years, in order to continue referring to the honorable member of the minister as you in his address? I consider I need to stress really on this one, Madam Speaker.
It appears the point of order is not clear. Maybe you can repeat.
sorry, the Honorable Member of Parliament, Honorable Kamchongo, a very good friend of mine, in order to continue referring to the Honorable Minister as you, instead of speaking through you, Madam Speaker. I need your serious ruling. Thank you.
Order, order. We are still studying the standing orders. We are bound to make mistakes here and there, so we are still doing the training. So you excuse the Honorable Member for using you in addressing the Honorable Minister. Honorable, can continue.
Thank you so much, Madam Speaker. Before I was disrupted by that maiden point of order, I was just trying to find out from the Honorable Minister, through you, Madam Speaker, what is Honorable Minister is going to do to pick up those discussions to ensure that the community of Sakile and all the various stakeholders who have got interest in that dump site are brought on board to explore that resource, which is quite rich. I thank you, Madam Speaker.
The Honorable Minister of Mines and Minerals Development.
Thank you, Madam Speaker, and thank you, Honorable Kampiongo, for that very good question. It's an issue that is close to my heart because I'm a copper belt man. I want to, through you, Madam Speaker, assure the House that the engagements that are going on that dump site are going to bring about a lasting solution. That's why I am saying we want to rebrand the Zambians that are found around that area. We have already engaged, Madam Speaker, in courts, the so-called godfathers, to try and make sure that we remove that criminal tag around them. The skills that they have can benefit us not only at the dump site, even in other mining areas, because as they are mining the dump sites, they are learning a skill from there. So we want to rebrand them. We don't want to call people the so-called Jerabos and all those names. What we want, Madam Speaker, is to call them to refer to them as small-scale miners who are contributing to the economy of this country. So what we have done will actually be very good for all Zambians. We want all small-scale miners. We have actually engaged the Zambia Small-Scale Miners Association. We have engaged the women associations. We have told all of them to form cooperatives. They will actually apply to our ministry, and we consider giving them artisanal mining licenses. They will go through safety instructions. It's going to be sanity all the way, and to make sure that right through to where they are marketing their mining product, they are actually taken care of and not exploited by the so-called investors. Thank you, Madam Speaker.
Thank you. At this usual statement, the Honorable Minister of Health.
Thank you, Madam Speaker. Madam Speaker, thank you for granting me this opportunity to update this August House and the nation at large on the COVID-19 situation in the country. Madam Speaker, Zambia recorded the first 2 cases of COVID-19 on the 18th of March 2020. Since then, the country has recorded 3 distinct waves of the pandemic, with a cumulative number of 208,267 confirmed cases, of which 3,636 deaths and 203,708 were recoveries as of 16 September 2021. The House may wish to note that all the 116 districts in the country have recorded cases. Madam Speaker, Zambia experienced the first distinct COVID-19 wave between July and August 2020, with a maximum weekly test positivity rate of 25.4%. The second wave was characterized by higher numbers of cases and deaths, with a wider geographic spread, and peaked in January 2021. The third wave started in the fourth week of May 2021 and has been the most aggressive, characterized by an exponential rise in positivity, unprecedented increase in the number of cases, hospitalization, and deaths reported on a daily basis. At the peak of the third wave, we're recording 200 daily admissions, with 75% of the hospitalized patients requiring oxygen for 2 consecutive weeks, while our intensive care units were always filled to capacity. Analysis of the COVID-19 trends shows that the country's third wave has been reducing, with positivity dropping from a peak of 26% in the week 20 to the 26th of June 20. Madam Speaker, our response. A multi-sectorial national response to COVID-19, enshrined in the COVID-19 National Multi-Sectorial Contingency Preparedness and Response Plan, was developed as soon as cases of COVID-19 were detected outside the People's Republic of China. The aim was to provide for a well-coordinated multi-sectorial preparedness and timely response mechanism to prevent and mitigate the effects of the COVID-19 pandemic. Government, through the Zambian National Public Health Institute, has been coordinating the technical response efforts to curb and avert continued transmission of COVID-19. Various public health interventions and restrictions were prescribed by government, informed by the epidemiological trends, laboratory data, and experiences within the country and globally. These measures are reviewed regularly to align to the COVID-19 evolution. Regarding coordination, Madam Speaker, various policy and technical committees were put in place to coordinate the response. These include: 1, the Council of Ministers for Disaster Management, which is chaired by our Honor the Vice President, Madam Nalmango, which provides bridging policy direction. 2, it provides technical support to the Council of Ministers. 3, epidemic preparedness, prevention, control, and management committees chaired by the Minister of Health and co-chaired by ministers of local government at national level. This, the United Nations family, Africa Centers for Disease Control and Prevention, the World Bank, and the United States of America agencies, among other stakeholders. This coordination structure is replicated at provincial and district levels, with provincial ministers and district commissioners as chairpersons, respectively. 4, incident management system. This, Madam Speaker, COVID-19 response stipulates actions and responsibilities for various stakeholders, including government and non-governmental institutions. Madam Speaker, various interventions based on the evolution of the pandemic experience include: 1, the application of the Public Health Act Cap 295 of the laws of Zambia and the statutory instruments number 21, 22, and 62, case detection and contact tracing, screening of international travelers and keeping track of alerts. Furthermore, school surveillance has been enhanced to ensure timely detection and management of cases identified in schools. A guidance document is available at all schools to support infection prevention and control, as realization of laboratory diagnostic capacity. The testing platforms are decentralized to support testing at provincial and selected, establishment of a system to track variants of the SARS-CoV-2, the COVID-19 causing virus, to inform interventions referred to as genomic sequencing. 5. Restriction and temporary closures of social amenities such as bars, casinos, and nightclubs and schools. 6. Resource mobilization and engagement of various stakeholders to coordinate preparedness, surveillance, and response activities. 7. Strengthening of infection prevention and control measures. These include, but not limited to, safeguarding supplies, including personal protective equipment, gloves, masks, among others, and monitoring and enforcement of compliance to public health measures in public places and events. 8. COVID-19 treatment and isolation facilities were identified and customized to ensure safety and adequate patient management. However, these have not been adequate, and there's need to create more space countrywide for patient management. Madam Speaker, some health facilities still need renovations to meet minimum standards for infection prevention and control. Over 12,000 oxygen cylinders with accessories were procured to support the much-needed oxygen therapy. We are further mobilizing more oxygen cylinders with accessories, which are expected to be delivered before the end of the year. 9. Capacity building through training and orientation of rapid response teams across pillars is ongoing to ensure responders stay current with new developments and practices. 10. Risk communication and community engagement activities, which include engagements with community gatekeepers such as religious, traditional, political, and civic leaders. The media, including community radio stations, continue to be engaged. Further, production and publication of information, education, and communication materials in English and local languages has been a COVID-19 vaccine program, which is based on a basket of approved vaccines for Zambia. Vaccines are being acquired through the following pillars, Madam Speaker. 1, the COVID-19 Vaccines Global Access Facility, which is abbreviated as COVAX Facility, which is a global initiative by the United Nations Family, Gavi, the Vaccine Alliance, and other partners. 2, donations of vaccine doses from bilateral and multilateral partners and through diplomatic channels. Thirdly, the private sector contribution to the acquisition of vaccines as guided by the Minister of Health to ensure that only vaccines that are safe, efficacious, and authorized are permitted on the Zambian market. 4th, government financing through domestic resource mobilization and partner support. Government has ordered 4.4 million doses of COVID-19 vaccines through the African Vaccine Acquisition Trust, known as AVAT, an initiative which is under the African Union and supported by the African Export and Import Bank. Government has already so far made a down payment of US $6.6 million, and subsequent payments will be made as batches of vaccines are received. Through this facility, the country has already received the first batch of vaccines, consisting of 129,600 doses, which is the Johnson & Johnson. On the whole, as at the 15th of September 2021, the country had received 1,120,800 vaccine doses, out of which 680,110 have been used so far. Out of the targeted 8.4 million eligible Zambians above the age of 18 years, only 3.8% are currently fully vaccinated. Madam Speaker, we are concerned. The national COVID-19 response has been faced with a number of challenges, which include the following. 1, there's a general anxiety among members of the public in complying with the prescribed COVID-19 prevention public health measures, including the 5 golden rules. 2, low uptake of COVID-19 vaccines, driven by myths and misconceptions which need to be addressed. 3, limited resources, including financial, human, material, both medicines and medical commodities, among of new SARS-CoV-2 variants. 5, imminent threat of a fourth COVID-19 wave. In view of the global trends, new variants, this August House, we are called to be ambassadors of change, starting with ourselves by adhering to COVID-19 prevention measures. As community leaders, we should use our cooperative advantage to promote comparative advantage to promote positive behavior change in our constituencies and beyond if we are going to prevent and control COVID-19 as a country. I wish to urge all of us to engage our communities and advocate for adherence to the stipulated public health measures, which include 1, wearing masks correctly and of not less than 1 meter. 4, avoiding crowded places like funerals, public meetings, and the like. 5, reporting to health authorities when displaying COVID-19 symptoms, including fever, cough, and difficult breathing. 6, encouraging members of the public to get vaccinated, as vaccination provides protection against severe disease and death. I further wish to urge those among us not yet vaccinated against COVID-19 to lead by example and get vaccinated. Madam Speaker, let me emphasize the need to mobilize adequate resources required to safeguard the health of our people. As we'll soon be debating the budget allocation, it is imperative that of our country, as this is what will enable us to attain socio-economic development of our country. In conclusion, Madam Speaker, allow me to thank His Excellency, Mr. Hakainde Hichilema, President of the Republic of Zambia, for prioritizing universal access to quality health care, as articulated in the UPND Manifesto. We are all aware that for a country to develop, we need a healthy and productive citizenry, and I urge members of this House to support this agenda. I further wish to thank the President for appointing the COVID-19 advisor to his office, as this will further strengthen our response to COVID-19. In addition, I'm pleased to note that His Excellency the President has led the way in championing vaccination against COVID-19 by graciously accepting to relaunch the vaccination campaign tomorrow, Thursday, the 7th of October 2021, at the Olympic Youth Development Center, OYDC, which is situated here in Lusaka. The relaunch is intended to rejuvenate the COVID-19 vaccination campaign in order to raise awareness and to create unprecedented demand so as to save lives, livelihoods, and the economy of our country. Madam Speaker, may I use this opportunity to seek the support of all the members of Parliament who have so far been invited to this launch, and hope that they will be, even whether they are vaccinated or not, it will just be good that they show the communities in their constituencies that they support vaccination of COVID-19. Madam Speaker, following the national relaunch, the provinces, the districts, the constituencies, the wards, and chiefdoms will be expected to launch their vaccination program in order to ensure quasi-government institutions, cooperating partners, learning institutions, private sector, civil society organizations, traditional leaders, political and religious leaders at various levels, the media and members of the public are all expected to fully participate in this vaccination drive. Our healthcare workers are also urged to arrange to take vaccines closer to where our people are, such as markets, bus stations, learning institutions, and places of worship through outreach services. Madam Speaker, I wish to reiterate that while COVID-19 restrictions have been eased, this is not the time to drop the guard. We must continue to observe the 5 golden rules and encourage everyone to get vaccinated. I will be failing in my duties if I did not appreciate and commend our healthcare workers and other frontline personnel who have been working tirelessly to fight COVID-19 while providing other routine essential health services, which we shouldn't neglect as a country. Finally, I wish to take this opportunity to thank the COVID-19 multi-sectorial stakeholders who continue to put in a lot of effort in the fight against COVID-19 while supporting overall health system strengthening. Together, we can defeat COVID-19 while protecting the gains we have made in other public health priorities. Madam Speaker, I thank you.
Thank you. Honorable members are now free to ask questions on points of clarification on the ministerial statement given by the Honorable Minister of Health. Honorable Member for Mufurira.
Thank you, Madam Speaker. I've been informed that where I'm sitting, there is a technical problem with the cameras. So, Madam Speaker, you're not able to see me and the diaspora. Minister of Health, thank you for that statement. It's very clear so far in this experience with COVID that there are benefits getting the vaccine, both at an individual level and also at the country level. So now, Minister of Health, is the government considering compelling or making it mandatory for public workers to take the vaccine in order to up the numbers of the vaccines and also to prevent severe infections in the country? Thank you, Madam Speaker.
Thank you. The Honorable Minister of Health.
Thank you, Madam Speaker. Thank you, Honorable, for that important question. Madam Speaker, we will see, we'll cross reactions of the public as it relates to following the 5 golden rules. Thank you.
The Honorable Minister for Fair, the Honorable Member for Fair.
Thank you, Madam Speaker, for elevating me. Thank you, Minister of Health, and I would like to also congratulate you for that appointment under the new government. Indeed, I'm very happy with the presentation and also the efforts that the ministry is making to curb this COVID-19. You did mention that the vaccination levels are at below 3%. And I wonder whether the government or your ministry has been able to find out, has there been any, the efficacy of the vaccine is in question. When Professor Mukonge came here to address us on COVID, I asked the question, does Zambia have a system of testing the efficacy of these vaccines, or we just get what we are given by WHO? He said that the efficacy is based on the recommendation by WHO. Now, I, for one, believe that, these things that come from outside and we are told and we believe is not sufficient. We have a mechanism locally of testing whether these drugs are of high efficacy or perhaps they have side effects. And in fact, some people still feel that, because some reactions have been quite adverse. So there is that understanding. Please just clarify whether investigations. Thank you.
The Honorable Minister of Health.
Thank you, Madam Speaker. Thank you, Honorable. First of all, when we import medicines into the country, we have an organization called ZAMRA, the Zambia Regulatory Authority, whose mandate is to ensure that they check every drug that is brought into the country, including medical equipment. So yes, all the medical equipment that come here, including the COVID vaccines, they are checked to ensure that they are safe. The other point is to say that what the Honorable Member was saying, that there's been negative effect, is actually not even correct. I think that the effect that has so far been recorded is simply that some people, they will, they will have maybe a short fever because of the vaccine. And of course, there's nothing that is 100%. Even the normal Panadol, there are people that react, they'll get a rash. But this is not to say that the vaccine is unsafe. So please, as members of parliament, you are the ones that are supposed to help your communities to understand and believe. If you yourselves, people who are well informed, who understand what is going on, begin to speak negatives, the people will follow that. So the fact still remains that it is the safest that if we are going to prevent the spread of this disease, the best is we get vaccinated. And by the way, countries now, some countries, even some airplanes, will not allow you to get onto the flight unless you have a vaccination. Personally, myself now, at my house, I want to start saying, if you are coming to my house, you must be vaccinated. So, in future, even some public places, there are people, just like now, they'll tell you can't get into a shopping mall without the masks because people are afraid. So the best is let's get vaccinated so that when the situation becomes bad in December as expected, we will at least have had protected ourselves. The situation now, Madam Speaker, is that most rich people and educated people now have gotten vaccinated. It means they have read and they've seen that is the best for now. So let us ensure that even our communities in rural areas, let's encourage them to be safe and to get vaccinated. Thank you, Madam Speaker.
Thank you. The Honorable Member for Kalabo Central.
Thank you, Madam Speaker. Let me appreciate the statement rendered by the Minister of Health. I would like to find out from the Minister, this is on the vaccinations, especially in the remote and the rural areas of this country, like Kalabo. Like the Honorable Member for Fera has indicated, there is still disbelief on the efficacy of these vaccines. What effort as a government have you put in to ensure that the people in the villages really come to understand that vaccination is very important? Whilst I agree that the honorable members should be the drivers, Honorable Madam Speaker, let me attest that I've been vaccinated on 3rd September. So for the people of Kalabo, let them know that this vaccine is real. So maybe, Honorable Minister, my question is on the sensitization and awareness so that the people in the villages really come to believe and understand the vaccination. Thank you, Madam Speaker.
The Honorable Minister of Health.
Thank you, Madam Speaker, and thank you, Honorable Member of Parliament, and for Kalabo, and thank you that you yourself, you've been vaccinated, and you have called out to the communities in Kalabo to follow your steps. That is a very good step. In fact, that is what we should be doing, all of us. And for me, as Member of Parliament for Chongwe, I also want to inform the people of Chongwe that tomorrow the President is relaunching the vaccination, and so I shall also be taking the Johnson & Johnson vaccination tomorrow. And I would like to call upon the people of Chongwe, all of them, to go to the nearest health center and get vaccinated, because most of the health centers countrywide have the vaccine. And I want to say that the President of the Republic of Zambia, Mr. Hakainde Hichilema, has decided to be the one to officiate so that the doubting Thomases must understand that this vaccine is safe and they must take it. He himself they can also take it. There's nothing unsafe. The other point is that when the president tomorrow officiates and relaunches this exercise, all members of parliament working with the district health office in their respective districts will be facilitated to ensure that they themselves, as members of parliament, will mobilize their communities to go and take the vaccination. Beyond the members of parliament, we are calling upon all the ward councillors countrywide to individually, again working with the district health department, organize the vaccinations for their wards. Our traditional leaders will also be facilitated by the district health departments to ensure that at traditional level, the traditional leaders also officiate at the launch, at the vaccination launch. Beyond our traditional leaders who are chiefs, we will also be working with the headmen in their communities, in their villages. That will also be done. Our role as a ministry is to facilitate from a technical point of view, but the role of the community leaders, the elected leaders, and the traditional leaders, the church leaders, we want the church to participate, and to that effect, we will be engaging the churches to not only announce, but also to encourage and also to participate in vaccinations. So this is how we are hoping, also working with the private sector, and I'm very happy, and I want to thank the Madam Speaker because she has also shown, commitment to ensuring that all members of parliament and our staff here get vaccinated. So we are expanding to all other sectors of our society to ensure that all of us Zambians must be vaccinated. Thank you.
Thank you. The Honorable Member for Wacha.
Thank you very much, Madam Speaker, and thank you so much, Minister, for the statement. Madam Speaker and the Minister, the President, the launching COVID-19 leaders, traditional leaders, us as members of Parliament, councillors taking leadership. For me, it simply shows me that this COVID-19 is actually becoming very, very serious, especially that His Excellency the President will be involved at that level to relaunch the vaccination. Minister, I'm just wondering, what has necessitated the relaxation of the COVID-19 measures that the government put in place, especially that just in a month or 2 months to come, we are anticipating another wave, if I'm not mistaken, even very, very serious compared to the waves that we have experienced so far. What has necessitated the government, through your ministry, to relax the COVID-19 measures, and the President again will be relaunching the COVID-19 vaccination? Thank you so much, Madam Speaker.
Thank you. The Honorable Minister of Health.
Very, very important question, Madam Speaker. So I'd like to thank the Honorable Member of Parliament who has asked the question. Madam Speaker, it is true that we have, as a ministry, announced some form of easing of the restrictions that were imposed on various institutions and the public in general. And this is because if you followed my statement, I told you that at the time that we were going towards at the time of the beginning of the third wave, the positivity rate was at about 25, 26%. Currently, as of last week, in fact now almost more than a week, consistently, the positivity rate has been at 2%, and now it's even at 1.6%, meaning that the situation has improved, and also taking into account economic factors, because you must also understand that the COVID-19 has a negative impact on the economy of this country. And it's a question of which way do you want to die, through the COVID or through poverty? So we have to give people a breather, especially that we are expecting things to be bad from December. And the idea was that we would be monitoring, or we are actually monitoring on a daily basis. If you have noticed, according to international norm, agreed norm, ministries of health are supposed to give an update every day. And therefore, you will note that every day we are giving you an update, so that when there will be something that will cause us to panic, when we come and say, please stop now, close your bars, even the public will be able to appreciate. So there was no point of us, getting people to get unemployed and causing a situation which is negative from an economic point of view. We took a decision, not as a ministry, but in consultation with all other stakeholders, under the chairmanship of Honor, who is in charge of the disaster management unit. And so through consultation with those stakeholders, that was the decision that came, which was announced by the Minister of Health. Thank you.
Thank you, the Honorable
Minister of Health. I'm concerned with the law of compliance indeed. That 3-point-something or less than 4% is not actually good for our nation. But one of the ways, Minister, that can help people to have the confidence in the vaccine that we are receiving can be like the way we had the Drug and Food Agency to certify that this product is safe. For instance, this bottle of water, we have the ZABS tag there to indicate that this water is free, is actually safe for human consumption. Now, maybe you can just give assurance to the nation that you are able to strengthen the national laboratories to come up even with measures to indicate that the vaccines that we are receiving are actually safe. And in that way, people will be able to comply to say the content in the drug is safe to the human body. Maybe you can give us that assurance as a nation. Thank you.
The Honorable Minister of Health.
Thank you, Madam Speaker. Thank you, Honorable, for the question. Yes, Madam Speaker, the Zambia Regulatory Authority does certify that a particular product or drug that has been imported is safe. So once it is certified as such, that is how we, as a ministry, through the former medical stores of Zambia, that is mandated now to buy, store, and distribute. That is when they collect from, for example, from the airports. And also, I think it is important to note that, like I was talking about the body which is under the African Union, that is actually not only giving Zambia, but all the African countries. So this is not one of those vaccines you go and buy from one individual as an individual country. These are things, drugs that are being procured using international standards of procurement, and even before they're procured in those countries which are responsible by the African Union, they've also been tested and also verified to be safe for human consumption. So please be assured that these vaccines are safe, very, very safe. And that's why the President has taken it upon himself to tell the public, or to show to the public, that as a responsible government, I'm sure you can trust the UPND government under the able leadership of the President. And so please help us to convince, to inform, to make our people aware. It is for their own good, for their own safety. Let us ensure that as members of Parliament, we in fact bring them ourselves to the various, or take them to the various health centers for vaccination. Thank you.
Thank you. The Honorable Member for Lukulu East.
Thank you, Madam Speaker. I would like at the outset to commend the noble efforts of both the Minister and His Excellency the President in rallying citizens to vaccinate in droves. Our vaccination levels are extremely and pathetically very low at 3.8%. Madam Speaker, I vaccinated somewhere in April, May, maybe 5-6 months ago, and I'm still alive. So members may draw lessons from me and turn up in numbers for these vaccinations, those that are expressing misgivings. Honorable Minister, I want to find out as a country, what minimum or target percent do we want to push our vaccination levels from 3.8%? To what level do we want to push, and by which date, so that we then can draw comfort that the majority of our citizens are at least vaccinated? So at what percentage and by when do you hope to push this 3.8%? Thank you.
The Honorable Minister of Health.
Thank you, Madam Speaker, and thank you, Honorable, for that support, and well done. As I indicated in the statement, Zambia has targeted 8.4 million eligible Zambians above the age of 18. And I did state that out of this, so far, only 3.8% are currently fully vaccinated. And indeed, as you yourself has ably said, this is really too low for a country, especially when you compare with some of our neighbors just across the Zambezi in Zimbabwe. I'm told our friends are going towards 20% so far, and we are still at 3.8%. Now, according to what was originally agreed under the African Union, Zambia signed up or agreed to say that of these 8.4 million eligible Zambians, by 30th of September, at least we should have reached 10% of those that should have been fully vaccinated. So 30 September was 5-6 days ago, and we are just at 3.8%. So you can see that from the time the vaccination started, the response has been negative, or very low rather. And this is why, as a new dawn administration, we have resolved that we must go out there on the ground and, just get the people to believe in this vaccination program, but so also to ensure that we do not politicize it. And that's why you will note that, Madam Speaker, that all the political parties that are available and known have all officially been invited, including the opposition, the main opposition party, the PF. We have invited everybody, and we are hoping that tomorrow all political parties can participate, can encourage their members to come, so that we unite as a country. This is one issue where we are hoping and praying, Madam Speaker, that third wave, a lot of our people died. Like I said, over 60 people were dying every day, during the month of May, June, July. And most Zambians know messages, and let's cooperate so that we can all save our people. Thank you.
Thank you. The Honorable Member for Mbavala.
All right. Thank you, Madam Speaker, and thank you, Hon Minister of Health, for this wonderful statement. Your Hon Ministration program, and I've recently experienced challenges in as far as the obtaining visas on international travel due to lack of a computer-generated vaccination barcode from Zambia, because here we are giving batch numbers of the drug as opposed to a computer-generated barcode. Is there any likelihood that the ministry could ensure that myself was vaccinated and also encourage the people of Mbabara constituency to turn up in numbers as we roll out the program there? And also to hear whether this would be done to ensure that international travel by Zambians who are obtaining visas outside is ended up. Thank you.
The Honorable Minister of Health.
Thank you, Madam Speaker, and thank you, Honorable MP. Currently, a certificate gets issued, and I hear what the Honorable is advocating for, and hopefully that will be considered. Thank you.
Thank you. Just by way of information, in relation to members of parliament and members of staff that have been vaccinated through the National Assembly Clinic, members of parliament 40, members of staff 247. So we still need to do more. Thank you. The Honorable Member for Chifuvu.
Thank you, Madam Speaker. The people of Chifuvu are asking to say, why do you say something and you do the other? Because you are saying the people must be vaccinated. Now the people to be vaccinated, you people who are there in parliament, you are still observing social distance when you are saying you are vaccinated, others are vaccinated from constituencies, others are vaccinated from within parliament. If you are vaccinated and you have confidence in the vaccine, why still we are not seeing a lot of people in the house? People are debating from committees and they are sitting elsewhere. What confidence will us have if you people don't have the confidence in the same vaccine? Then secondly, the issue has been that...
Order. One question per honorable member, please.
Okay. So we want to find out if members of parliament are all vaccinated, because where vaccination program has been done, like in the Western world, we have seen stadiums already vaccinated and have record. Why haven't you put them in the house? So that we serve as an example to say, you can see now, parliament is full with people because they are vaccinated. Then even our people in constituencies who have confidence in the vaccine, but we are still sitting separately and we are telling people to be vaccinated. So, Madam Speaker, this will not go well with the people on the issue of vaccine. So, I want to find out why the Minister of Health has not taken a step to ensure that all those who are vaccinated start appearing in the main chamber, and those who are not vaccinated can go in the committees, so as to serve as an example and build confidence in our people. Thank you. Yeah.
Thank you. The Honorable Minister of Health.
Thank you, Madam Speaker. And thank you, Honorable. I want to believe the Honorable MP is campaigning that he should be brought into the main house. But let me just answer the question. First of all, the Speaker's statement did not say all the MPs are vaccinated. I think the number that she has announced is 40. So clearly, we're not even half. And that's why the Speaker has called upon members of Parliament to ensure that they take advantage of tomorrow's event. They take advantage of our own clinic here, which is vaccinating. I'm sure once we are 100% vaccinated, I'm sure Madam Speaker will consider that request. Thank you.
Thank you. The Honorable Member for Shiwangandu.
Thank you so much, Madam Speaker, and I appreciate the statement from the Honorable Minister. Honorable Minister, As a COVID survivor myself, I was very happy to take the second jab right in Shwangan constituency. Response to a question for an hour answer. What are you doing to ensure that our rural communities are equally catered for, so that when I go into the constituency, I'm able to encourage them to say, go to clinic so and so. You'll be able to find a vaccine so that you get vaccinated in anticipation of the fourth wave, which might be lethal than what you have experienced. I thank you, Madam Speaker.
Thank you. The Honorable Minister of Health.
Speaker, and thank you, Honorable, for that important question. If you recall, I have said that we want to work with the members of parliament as a ministry to ensure that even rural areas like your constituency, where you may not have a health facility within the near, your people may not be near to a health center, we can organize mobile clinics to ensure that such a program is implemented. So what I would want to say is that those MPs that would like to do their launch can get to us, actors within your constituencies, to support the vaccination program. Thank you.
Thank you. The Honorable
Minister of Health, for your powerful presentation and points. I heard you mention issues of genomic sequencing, and this has become a tool by most government as well as authorities and researchers as a way to detect COVID-19. What genomic surveillance capabilities you've put up at the ministry to ensure that in an event,
to know the type of variety that we have as a country. Thank you.
Thank you. The Honorable Member for Kabwe Central.
Thank you, Madam Speaker. Thank you, Honorable Minister for Health. May I inform people of Kabwe Central constituency that indeed I was also vaccinated and nothing happened to me. No metal is sticking to my body. And they have to go out in numbers and be vaccinated. But the Honorable Minister, my question still is on a concern on the rural community, reaching out unto them. Yes, I can come to your ministry and do a launching, but it won't be enough to reach out to all people in all parts of the rural community. I'm thinking that are you thinking of maybe considering other institutions that have got a lot of vehicles that are not in use right now, so that you can surrender it to the district health so that they can reach out to most parts of our constituencies so that the exercise is done as quick as possible. I say so because on Monday I was found that as a member of parliament, we don't have transport to reach out to the rural area for them to go and do the vaccination. Thank you, Madam Speaker.
Thank you. The Honorable Minister of Health.
Thank you, Madam Speaker, and thank you, Honorable, for that question. I want to say that when I said that you get in touch with the ministry, it was not for us to do the vaccine here in Lusaka, but it was basically for us to work together with the members of parliament and other important stakeholders from the very districts that you are talking about. And I'm sure in working out in the same way that we were able to reach every constituency in terms of information and the campaigns, I'm sure honorable members together with government can work together to ensure that information goes out. And also you have radio stations, rural radio stations, well, those also can be used. But in terms of the very commodities, I've already said that it is possible that we can use mobile clinics to reach far places. We can also use the flying doctor services to reach remote and areas that are not accessible. Also, it did indicate that so far Zambia has ordered 4.4 million doses, and we've been able to pay some down payment, and government is committed to further make payments to ensure that we received all the 4.4 million doses. As I speak, we have over 400,000 doses, which requires to vaccinate the people. So we are prepared as a government. I think the challenge is the demand side, to make our people accept to come in numbers to be vaccinated. Let's get to a level where we should be saying vaccines are finished, not where we are saying the people are not willing to take the vaccine, because that even partners that would like to support us cannot support us when whatever we have, even where we're being supported, is not being consumed. Thank you.
Thank you. The Honorable Member for Pongwe.
Thank you, Madam Speaker. Thank you, Honorable Minister. Honorable Minister, Zambia experienced a shortage of ventilators in the first, second, and third wave. I just want to find out how prepared is your ministry in case of the third wave in terms of ventilators. I thank you.
The Honorable Minister of Health.
Then thank you, Madam Speaker, and thank you, Honorable, for that follow-up question. Indeed, there are a number of medicals and medical equipment that will be required, and other commodities that will be required to ensure that we get everybody that is due to be vaccinated. All this requires resources, as I did indicate, and I also indicated that so far the response from government, mainstream government, the response from other stakeholders, donors, and including the private sector has been positive. And I want to say that with this positivity, where everybody's coming forward, I'm certain that we will be prepared to ensure that the fourth wave, once if it does come, we will be able to save our people. But let me say this, in particular what you've just talked about, the equipment, the ventilators. Currently, I'm pleased to say that we have even Zambians in the diaspora who we just today, through the Minister of Commerce, indicated that they had done some fundraising and had some ventilators which they want to send to Zambia just to support. So the goodwill is there, but let us ensure that our people demand more for these vaccines so that then people can see that we ourselves as a country, we are ready and we are serious about this pandemic. Thank you.
Thank you. The Honorable Member from Nkana.
Madam Speaker, thank you so much. Honorable Minister of Health, tomorrow you are launching a national vaccination program in the wake of the fourth wave. Now, are you able to assure the nation regarding the effectiveness of the Johnsons? Because you wish to know that the paranoia amongst our citizenry, including myself, when we were readying ourselves to go and get vaccinated with the Johnsons, you know, information surfaced to the effect that the Johnsons was not as effective as the AstraZeneca towards the third wave. Can you assure the nation that as we get vaccinated with the Johnsons, we will be in a good position or safer position as the fourth wave, you know, hits us? I thank you.
The Honorable Minister of Health.
Let me thank you, Madam Speaker, and thank you, Honorable, for the follow-up question. I want to say that currently Zambia does not only have the Johnson & Johnson variety in terms of vaccines. They also have two other. This Johnson & Johnson is the one you take one jab, and the other one, the other two varieties, you have to take two. And so, you know, for those of us that may be busy, we choose to go for the Johnson & Johnson. And let me say that all these various variety of vaccines, they've all been said to be good. And you'll find that if you Google on your tablets and for their own research, they'll be able to tell you that maybe they vaccinated 1,000 and from the 1,000, only 2% had a complaint or 0.1 had a complaint. Like I said, there is no drug that is 100%. It depends on the body. Even chabe mafuta ozola pamobili. Sorry.
Meaning,
I wanted to say that even just body creams, they react different on people. Even food when they just drink beer. So it's the same, even with the vaccine. The truth of the matter is that all the 40 MPs, for example, who vaccinated, not even one said he was sick or he had a negative reaction. That just shows how good these vaccines are. So they are just stories. The other day, Honorable MP for Matero was giving us some funny myths about men not functioning if they take this and that. So all those are just stories, you know. Sometimes, Zambians, sometimes we just like to joke about serious issues. I think that there's nothing like that. Please let's advise our people to go and vaccinate tomorrow. It's a good chance. As I said, you can come to the site where the president is. You can go to your nearest clinic. You can go to any clinic, including Parliament here for the parliamentarians. It's just good that we want to show that, we have 40 parliamentarians who are vaccinated, and the rest will tomorrow, as the Speaker has commanded us, we will all go and vaccinate. Thank you.
Thank you. The Honorable Member for Matero.
Thank you, Madam Speaker. I don't know why they're talking about Congo dust. That it has different effect as vaccine. Honorable Minister, thank you for the statement, well delivered, and indeed you've come in with a bang. This is another topic that is close to my heart, but I just wish to ride on the other member that said in the House, if all of us are vaccinated, why should we continue wearing masks? Even in other parliaments, this is not happening. I don't even know the ministers. I've never seen them because they wear masks. So it makes it easier so we can speak to the people of Matero. I see time is running out. So you need to make it clear, Honorable Minister, what are the do's and don'ts after you opened up the restrictions? They were well timely. If anything, out there, I must tell you, they celebrated, but they said, too late. We already opened the bars. We are already interacting